So our presentation today was why Auditory Verbal Therapy, highlighting to the audience what Auditory Verbal Therapy is about, how it works, and obviously strategies that they can take away and then utilise with their children in the home.
Things like realising the effect of background noise on a child's listening, how they can improve the listening by coming closer to reduce those, using acoustic highlighting to makes listening easier for children, and a range of auditory verbal strategies that were addressed.
So obviously what it is, it's developing speech and language through listening. So the big focus is on teaching your child to listen. Obviously it heavily involves parental guidance, but it also involves parental input. It's about creating a listening environment all of the time, so not just some of the time. It's 24 hours a day, 7 days a week. We follow typical stages of listening, language and speech, and it requires things like early identification and diagnosis. It requires things like obviously maximising the auditory potential of the child, whether that's with a cochlear implant or whether that's with a hearing aid. Obviously we need parents who are committed to following up with things at home, so you need to be able to provide one-to-one time with your child, and obviously audition is the primary focus again, so that's that listening, and it's about the whole child. It's not just about parts of the child, it's about the cognition, it's about the language, it's about the listening, it's about the speech, it's the whole picture.
One of the techniques that we talk about in auditory verbal therapy is the auditory feedback loop, that we listen to what we all listen to what we are saying and correct the words that we say, or correct how we say how we're saying what we're saying through listening. And that's one of the things that we use with children. We help them monitor their own speech through listening and to make closer and closer approximations to the adult model. Listening is the most reliable way of getting speech information. Only 30% of what you actually say can be speech read. Sounds like k and g are made at the back of your throat and can't be read at all. Other sounds look the same on your lips, like l, n, t. They're all made at the same place, so they look the same. Even ones like pat, p, b, m, pat, bat, mat. You can hear the difference quite clearly, but if I just give you the lip pattern, then you're really not sure which of those three words I've actually said. And now we'll look at some of the strategies that are specific to auditory verbal therapy. So first of all, for the children to understand that sound has meaning. Another thing that we're really aware of in an auditory verbal program is appropriate positioning. So you sit on the side of the child's best hearing. So if it's child's got a unilateral loss, you'll be sitting on the side of the better ear. Also being aware of the impact of background noise. So if you want your voice to be stronger than the background noise, you come closer. Being aware of the auditory environment too, so like turning the television off if you're not actually listening to the TV, so it's not background noise when you're actually trying to play and talk with your child. We encourage the use of parentese. So parentese is the way that that parents speak to children to help them develop language. So the way parents speak to hearing children, even with so much more pitch change and a slower rate. When you say, uh-oh, did you drop your banana? Oh dear. And you've got lots more of this slower rate and the up and downiness of language. We know that helps hearing children develop language, so you encourage parents to use those kind of strategies with deaf children who are just starting to learn language. So it's a whole lot of techniques and strategies that the therapist is aware of that they coach the parents to use to make learning language easier for the child. And using a wait time. Like when the child's learning to speak, you don't just want to totally flood them with language. You also need to give them an opportunity to talk, an opportunity and an expectation for them to talk. So you can do that with your pacing of language, that you have a turn in conversation, and with all those that parentese cue, and then you kind of wait expectantly for the child to tell you something back, and even, whether it's just one word or a sentence or something, so that they learn that conversation is a two-way thing. Most children, when they're around 18 months to 2 years of age, they imitate what a parent says just as a natural course of events. So usually they imitate the last word of something that you've said. So if you said, okay, let's get ready, we're going in the car, they'll say, car, and then they're doing that so that they're listening to themselves, and they make a closer and closer approximation to the adult model. There are another range of techniques that we use. Acoustic highlighting is one of them. So we know stress is one way of highlighting what it is that you're saying. Go and get your pyjamas. So you can put more stress on the word that you really want them to hear and remember. A little pause before the most important thing is another kind of acoustic highlighting strategy, because it makes that word stick out a little bit more. Not just go and get your pyjamas. Go and get your pyjamas. It kind of makes it, okay, that's the bit I have to listen to. Knowing that it's easier to hear and remember the last word of a sentence rather than the word that's in the middle of the sentence, so putting the key words at the end. An auditory sandwich is another one, so that if you say something like, what do you want on your sandwich? Do you want jam or Marmite? And you think, you've said it, but they haven't quite heard it or understood it, so that's the first layer of the sandwich, using their listening. The next layer of the sandwich is, if they haven't got it, you add something to help them get the cue. So maybe you add pointing or a gesture or showing them or taking them or adding lip reading. So do you want jam or Marmite? And that, okay, they've understood, they've chosen. So then the next layer is putting it back into listening again. Do you want jam or Marmite? So now that they know what it is you've said, they can have a listen to, what does that sound like again? So it's listening, another supportive technique, and back into listening again. Always being aware of extending the child's vocabulary, expanding on the child's utterance. So if the child gives you a 2-word sentence, which they're likely to do when they're around 2 years of age, if they say, Daddy car, you can say, oh yeah, that's right, Daddy's gone in the car, he's gone to work, he'll be back home later. So expanding on the child's concept. The auditory feedback system, which is monitoring what they say and making an ever-increasing approximation to an adult model. And we want to teach them to listen so that they can use listening for learning.
We found at creche, if there was too much background noise going off, he'd pretty much tell the teachers to take the microphone away. Is it best to have it on all the time, or just do you, like say for story time, that's when you wear it, or is it better to have it going all the time?
I mean, I would say to a parent that it's when there's focused listening occurring. So that could be small group work, it could be mat time, it could be a story time. But if he's outside playing and the teacher's still got the FM system on, if she's having a conversation with another child, he's hearing that.
Yeah.
So it's it's actually about when he needs it. So I would be saying group time, mat time, but not when he's doing free play. I mean, the session today was, it was enjoyable. There was questions that were challenging, but also brought food for thought to families. And I mean, ultimately, for me, it's actually about bringing information to parents so that they can then actually make a choice for themselves and work with that.
Most of children will have the ability to learn to listen and speak, and if you kind of practice that a little bit using some strategies, then it helps them listen when listening conditions aren't so good.